For this session, we'll introduce Greg Jungles, Health Tech Startup Catalyst Advanced Technology Development Center, Chris Appleton, founder and CEO, Art Pharmacy, Matt Golden, co-founder and CEO, Matt Habit, Charles Creighton, Quality Medical Director, Primary Care WellStar Health System, and Adam Klein, Director of Behavioral Health, CareSource.
How's everybody doing? Are you holding up for the last session of the afternoon? Thank you for coming. We really appreciate it, and thanks to our panel. We're taking a slightly different approach to this panel. It's about innovating in your own backyard, and what we have is kind of in pairs. We have two startup founders and two enterprise healthcare organization leaders that are working together to go through pilot programs, and so we're gonna be working a little bit in pairs in this session, but I hope you can hang with it. According to a recent Mental Health America report, 23% of adults have experienced mental illness in the past year, and over 20% of adolescents have had a major depressive episode in the past year as well. Also, Fortune reported in May of this past year that mental illness costs the U.S. $282 billion each year. According to the Alzheimer's Association, 1 in 3 older adults dies with Alzheimer or dementia. Care for Alzheimer's and other dementias will cost $360 billion by 2050. And over 11 million Americans provide over 18 billion hours of unpaid support for people diagnosed with Alzheimer's and dementia. These stats are not new to many of you, and there's already been conversation about mental health on stage, but it really highlights the ongoing challenges that Americans face and the critical need for behavioral health services and support in the U.S. Today, we have the opportunity to meet two of the startup founders taking different approaches to helping address the behavioral health crisis in America. We also have two respected healthcare organization leaders with local ties who are focused to addressing the challenges of their patients, their members, and the care providers that they work with. These organizational leaders are championing pilots with these local tech startups in their own backyard to innovate and drive solutions for their respective problems. Let's get started by a quick introduction of the panel. So Matt Golden, to my left, is CEO and co-founder of Atlanta-based MapHabit. MapHabit's evidence-based interactive step-by-step guides help create healthy, sustainable habits to improve daily lives of individuals with intellectual and developmental disabilities, autism, traumatic brain injuries, as well as individuals living with Alzheimer's disease related to dementias. Dr. Charles Creighton, Quality Medical Director and Primary Care Physician at WellStar Health System and MapHabit Pilot Champion. WellStar Health System, nonprofit healthcare organization based in Georgia, and is one of the largest and most integrated healthcare systems in the state. WellStar provides comprehensive care through a network of hospitals, urgent care centers, and medical practices, serving a population of more than 1 million residents in the metro Atlanta area. Adam Klein, Director of Behavioral Health at CareSource, and is Art Pharmacy's pilot champion. CareSource is a nationally recognized nonprofit managed care organization serving over 2 million members. Founded in 1989, CareSource administers one of the largest Medicaid managed care plans in the U.S., and the organization offers a variety of health insurance plans, including Medicaid, Medicare, and health insurance marketplace products. Chris Appleton is the founder and CEO of Atlanta-based Art Pharmacy. Art Pharmacy is a healthcare services company that provides social prescribing services to address healthcare's biggest challenges relating to mental health, loneliness, and chronic disease. And I'm Greg Jungles. I'm the Health Tech Catalyst startup at ATDC, as previously mentioned. ATDC, housed at Georgia Tech, is the oldest technology incubator affiliated with the university in the country. And we are currently have a portfolio of startup companies across all industries that exceeds over 150 companies. over 30 of which are in the healthcare arena. So with that, I would like to start the conversation by getting a little bit of background and having each of our panelists have a quick conversation with you. So the question I'd like to pose is, you all have uniquely pursued a mission in your careers that have led to a common focus on addressing aspects of behavioral health and the crisis in America. Share with us your thoughts on the crisis, how it impacts patients, members, and care providers, and what your organization is doing to disrupt the status quo and drive positive change. Dr. Creighton, let's start with you.
All right, thanks, Greg. Well, first and foremost, I'm a primary care internist, have been for 28 years, so I definitely understand the joy of primary care, but also the challenges of primary care. And, you know, the estimates are about 25% of primary care is behavioral health related. So we see it day in and day out. Now, on top of doing clinical practice, a couple years ago, I took on the role of quality medical director for our primary care and medicine service line. So one of my goals with that is to identify the best evidence-based practices so we deliver world-class healthcare to all our patients every time. But the second goal I wanted to do is I wanted to make life easier on my colleagues. Primary care is strained, so how do we make life easier for them? So one of the roles I do at Wellstar, I'm also our falls champion. So how do we prevent falls in our offices? How do we prevent our patients from falling? And one of the things, if you look into falls research, is you should partner with local agencies. So one of the local agencies I looked up was the Atlanta Regional Council. You know, what resources do they have to prevent falls? And you're wondering, why is he talking about falls? He's on a completely different thing. But on the Atlanta Regional Council's website, I saw this very intriguing link. It was, do you or a loved one have Alzheimer's disease? Now, I said I want to make life easier for my partners, and things that take a lot of time. Patients with dementia take a lot of time. Their caregivers are desperate, the patients are scared. So anything we do to help with that, we create access to me because I'm not having to deal with it. So I'm sure it's every tech entrepreneur's dream. They got a cold call from me. I'm like, hey, I'm Chuck Creighton. I'm the quality medical director at Wellstar. I'm interested in learning about your product. So that's how we got started.
Thanks. So, Adam, how about CareSource?
Sure. Thanks, Greg. Good afternoon, everybody. Thanks for sticking around, making it to the last session. I'm Adam Klein. I'm the Director of Behavioral Health here at CareSource. Prior to my foray into healthcare and managed care, I'm also a licensed counselor. I got my start within the therapeutic foster care space and DFACS for Florida. So my passion, children and adolescents and how we can affect programmatic change. One of the big things we do at CareSource is we concentrate on whole person health, whether it's the physical. Dr. Crane talked about integration of health, medical and dental. Unlike what I could maybe do in direct practice with a one family at a time approach, we can come up with pilots and programs we can affect multiple kids at a time. It just so happened that through a mutual friend, I got introduced to Chris and we were able to start a pilot program. Our market president and our medical director, who is here in attendance, challenged me a couple years ago and said, Adam, there has to be another way to do things. There has to be more to offer than just the traditional individual, family, and group therapy. Try to think outside the box. And alternative modalities is what we've really seen in the behavioral health space that'll move the needle. And Chris and I are going to talk more about the partnership and the great outcomes we had with Heart Pharmacy.
Great, thank you. Matt?
Thanks for having me, everyone, and I'll echo what was said. Appreciate y'all sticking around. So yeah, I was absolutely thrilled to get the call from Dr. Creighton. Typically, it's a family member who's trying to understand, what they can do to better support their loved one with, who's struggling with dementia. And just by the show of hands, how many of you in the room know someone who has Alzheimer's disease or dementia? All right, that's a lot. That is at least 80%. It could be even more. So if we asked that question maybe 10 years ago, you may have only had half that number of response. Unfortunately, Alzheimer's disease is exploding as people live longer, as our bodies are fortunately having these great treatments for heart disease and cancer. Our bodies are outliving our minds, and unfortunately, the stat that was mentioned about 1/3 of the adults die with Alzheimer's disease is really scary. My motivation for getting into behavioral health was my uncle. My uncle got basically he was diagnosed with Alzheimer's disease in his 60s, which is really young. Huge mentor in my life, got me my first computer, just was an amazing person, and really got me my start into entrepreneurship. And to see him, forget how to make coffee, not being able to put on his clothes in the right order, and then looking at my aunt, who's a family caregiver, who had no healthcare experience, and her trying to understand, why is he struggling with these most basic tasks? It just took me back, and I was shocked. I had no idea really what Alzheimer's disease was and how it impacts people. And while I wasn't the primary caregiver, it was something that really stuck with me. I mean, he passed away in 2004, and I ended up starting Map Habit with a neuroscientist in 2018. It was that experience that really empowered me to say, how can we make this better for those who are going through this? That you're just thrown into that diagnosis. People are having to quit their full-time jobs. They're having to, reskill and learn this new set of duties that, they have no preparation for. So, behavioral health is very personal to me. By the show of hands, it's something that's impacted everyone. And, our job as innovators for Chris and I are to really improve the overall quality of life and independence for those that are impacted.
Great, thank you. And Chris.
Lots of entry points into this work for me, but I think one I'll share, crisis text line, which is just what it sounds like. It's a crisis text line, mostly focused on young people that are having some sort of mental health crisis. Earlier this year in the spring, released a study analyzing 87,000 text exchange where teenagers text in and are connecting with a volunteer that's on the other end of the text line to help them through crisis. And the number one thing that those young people asked for to better manage their mental health was opportunities to connect with others. The number two thing was access to arts, culture, and creativity. And the number three thing was access to traditional mental health services. And so when you've got 87,000 people asking for, young people asking for an alternative to traditional mental health interventions or treatments, we think maybe we should do something about that and meet them where they are. At the same time, in the marketplace, there's this huge problem, more demand for mental health services than there is available supply. Nobody needs to be convinced of that. We've been hearing about it, the workforce challenges all day today. Yet, in every community in America, there's arts and culture on every street corner. Our local museums, theaters, dance studios, community arts centers, libraries are providing these resources. But the arts and culture field is ill-equipped to talk to the healthcare field, and art pharmacy comes in to be the intermediary in between so that members at, young people at CareSource or other partners of ours can get access to these resources in their community. We're the bridge.
Great, thank you. So Adam, tell me a little bit about how innovation happens typically at CareSource, and if in fact the partnership with Art Pharmacy, how that was supported by the process, and even how it wasn't supported by the process.
Yeah, thanks, Greg. So innovation for us involves a lot of predictive analytics and data mining to try to assess what a particular problem is. For the one that led to the partnership with Art Pharmacy we were looking at kids who cycled through the ED, residential facilities, and/or acute behavioral health inpatient facilities, high frequency. Typically, your high utilizers or kids that are up on the bedboard that you're looking for placement. And we did some data mining, and those are maybe the riskiest of the risks. So we started a pilot, which we called Stronger Together, and we were trying to think of, as I alluded to in the intro, what are some outside-the-box ways, besides just your traditional individual family group therapy, that we could try to make a difference for some of these kids and these families. So through a mutual friend, someone actually, kind of like what Dr. Klein was saying, I think I actually made the first outreach and introduced myself. So actually, as the payer, reaching out to Chris saying...
It happens like that every time.
All the time.
Call.
Just kind of rolls off there. So, no, but it's also a testament to organizations as Chris and, also us as a health plan. We're looking for ways to innovate. Like I said, our market president and our medical director said, Adam, try to come up with something. What is it that we can do? So I outreached to Chris and said, look, I have this subset of roughly about 170 kids. I'm looking to see, is there a way we can keep families together, which was the essence of our Stronger Together pilot. Reduce the amount of times that they're admitted, and if they should be admitted, reduce the amount of days that they're there. So Chris and I got together, and we were able to, through some grants, get some kids over to Art Pharmacy. Overall, the Stronger Together pilot had roughly a 50% reduction in inpatient admits as well as visits to the ED for behavioral health. But one of the things I'm most proud of, and Chris and I have been talking about this in the last couple of weeks, although I like to say I will say there was success for all the kids that are in the pilots. Some of the best testimonials we found were the kids who went to Art Pharmacy. And Chris and I were sharing in emails over the last week and even in the green room, one mom saying, I have my daughter back, or I haven't seen this, or I haven't seen, my son so happy in quite some time. So let me pass to Chris on that.
Yeah, I think one of the things that's about for me is that, there's a move towards, as there should be, more personalized or even precision medicine on our physical health. We also should be demanding personalized medicine for behavioral health, right? We should meet people where they are. And I think that's what this partnership has really enabled.
Great, thank you. So Chris, sticking with you, what was, obviously all startups hope that they have inbound opportunities. In this case, both turned to be the case. Real quick for Adam and Dr. Creighton, was there any intentionality to finding a local partner?
Not really any intentionality, but luckily Matt offered a very unique solution. It worked out wonderfully that they were in Atlanta. That's probably why they were on the Atlanta Regional Council website. But it made it so much easier having them come out, meet with us. They've been a great partner. Every time I introduce a new area where we want to try this, they're always on the spot. They're ready to serve us. They're eager to help us to change the process, to change our processes, to do better with this project.
Fabulous. Adam?
Yeah, and I go back to my original background within therapeutic foster care space. There's something to be said when you go to that kid's house and you sit down, or you go to church and you sit down with mom, dad, partner, spouse, caregiver. There's something about it in the community approach. And again, same thing. It just so happened the greatest concentration of the kids we had on the pilot were within the 285 loop, Atlanta proper. That's also where Chris conveniently is located. But over the last couple of years, you guys have also moved to a virtual model, right, which also opened up access, so you guys are statewide. So, it was a win-win. Couldn't have lucked into it better, I would say.
Great. So Matt, this is going to be directed to Matt and Chris. Just give us a quick overview of your product, your platform, and what the offering is, and share with us whether or not all the work you did as a startup to define what you believe to be the value proposition that was going to resonate with your customer actually was the value prop that ended up driving the championship, Dr. Creighton being a champion or Adam being a champion for you.
Yeah, so MapHabit is a behavioral health platform that allows people with neurodiverse types of conditions like Alzheimer's disease, traumatic brain injuries, developmental disabilities, really build habits and routines so they can stay at home and thrive, and also reduce the burden on the circle of support, which can be anyone from a family member, it could be a provider or a therapist or someone else like a friend who's really helping them live the life that they want. So we started the company, myself and neuroscientists, about 6 years ago, really focusing on individuals with Alzheimer's disease, and we thought that let's build this technology platform. Let's design it so it's really simple to use, large buttons, not a lot of things to choose from, and then the person with dementia, no matter if they're early stage or late stage, they're going to just latch onto it because no one has done it before. Well, that wasn't quite the way that it turned out. If you've used technology in your day-to-day life, like most of us have, yes, that kind of intervention is going to be an organic, easier thing to start utilizing. But someone who's in their mid-80s, which is the majority of the people with dementia, they didn't use technology as part of their career. They may have fortunately now started to use technology due to COVID, and one of the few silver linings in it. But still, just doing a FaceTime with a loved one is a lot different than actually, configuring a daily routine so that you can build, make coffee on your own and don't have to ask your support partner to do that for you. So it was very humbling early on as we did some initial product discovery and user testing. We realized, at least with the older adult stage, it's best to work with a caregiver, and usually it's a child of the person who's supporting their loved one, and that was the modality is not only supporting the caregiver in their making their lives easier when working with the person with dementia, but focusing heavily on the caregiver's own self-care. Often when you're supporting someone with a neurodiverse condition, you are all in. You want to do everything you can to make that person's life better. And what ends up happening is you forget about your own health care. You forget about going to your own appointments. You don't take breaks throughout the day. You try to do everything, and you develop what's called this learned helplessness, where you feel like you have to do everything for that person. And what ends up happening is you end up burning out, and it becomes a massive issue. And unfortunately, it's becoming more and more often that the person who's supporting the person who has these conditions will pass away before the one who actually has the disease. So we learned a lot of this. We were very fortunate to have a number of NIH grants. My co-founder is a career research scientist, and he's taught me how to write these grants and be a principal investigator on there. But long story short is the initial use case for an assistive technology and having it designed with a very person-centered view was right in theory, but there's so many adaptations we had to do throughout the way and so many failures that when you have that many failures and you iterate through the design, you end up finding something that works.
Yep. So you obviously, if I recall with the time I spent with you, you did not start with health systems as your go-to-market strategy.
No, we started in much lower barrier to entry clients. We worked a lot with assisted living, some home care that, maybe we're really looking for it as a competitive differentiator, not necessarily, utilizing it in the way it was designed, which was great to get some early revenue and traction. We were able to prove out some use cases, but it's really when we started to, go up the food chain, if you will, and have amazing partners like Wellstar, and thanks to Wellstar Catalyst for believing in us, along with Dr. Creighton and various other health systems and now health plans that we work with, that we're able to really dial in onto some of the clinical outcomes. Things like Dr. Creighton mentioned about fall reduction, or Adam's mentioning within foster care system and improving placement stability and making sure kids that are involved in art pharmacy are having these other kind of social ways to engage, which really do play a part of our total healthcare. Having those kind of learnings with these more sophisticated entities is really the path to scale amongst innovative companies.
Great. It really sounds like the partnership that you have with Dr. Creighton has helped you craft the value prop that addresses WellStar's challenge that Dr. Creighton was trying to solve. So Chris, real quick on Art Pharmacy and the product and service that you provide. You've touched on it to some degree. If you can cover that just briefly, if you want to add anything. But also, what was your assumption around value proposition and how did it play out with CareSource and Adam?
Just share a little bit more about Art Pharmacy. So we're a tech-enabled, human-powered solution. Our technology matches our members to the highest efficacy engagements in the community for them. And then there's a care management program that comes along with it. We build these networks. We work across the country and build these networks in each market of hundreds or thousands of community-based organizations that get vetted, and the specific activities that they offer in the community are what make their way into our platform that our members then have access to. I heard early on before we launched Art Pharmacy that if you're building a mental health company, the instinct is going to be to go direct to consumer. It's easier, it's faster, but about 5 years down the road, you'll realize you've made no money, and you're going to want to go to health plans. And so from day one, we really decided that our go-to-market strategy would be with managed care organizations with a real focus on the Medicaid and duals population. That is where the need is. The value proposition, in addition to providing alternative therapies that we know people are hungry for, is really around access and time to care. The network adequacy for Medicaid plans for behavioral health providers is really tough because reimbursements for behavioral health is really tough. And the worse it gets, right? So if I'm willing to pay $200 an hour for out-of-pocket self-pay for my kid to be able to see a therapist, that therapist says, wow, do I really need to be in network with the health plans? Which means the folks that can't afford the $200 an hour out-of-pocket have less and less access. And so I think that is part of the value proposition, is that it is available, it is accessible, and it's something that people want to do and participate in. I'm certainly not here to say that individuals don't need to be in more traditional forms of behavioral health treatment, because they certainly do. People that need to be on meds need to be on meds. People that need to be in, one-on-one psychotherapy need to be on one-on-one psychotherapy. But I got to tell you, most 14-year-olds don't want to do that at 2 p.m. on a Friday afternoon. They'd rather be in the dance class or the music workshop or at the museum with their friends, being social and engaging. And guess what? Therapy's purpose is in part to get them to do those things anyway. So that's the way that we think about how we position our pharmacy for our partners.
Great, thank you. Now on to the experience and a little bit around execution without boring everybody. Dr. Creighton, tell me a little bit about the scope and the objective of the pilot with MAP Habit and kind of how that was defined.
Well, I mean, the first barrier we really had to get over was how are we going to pay for this? Matt had mentioned Catalyst, and if I had a couple possible funding opportunities. We have a foundation. I could have went through the foundation. I involved our population health department. Do they have some money? Do I go through the traditional budgetary cycle? And that all took a whole lot of time. But luckily, we have an arm at WellStar that focuses on innovation and kind of investing in innovation solutions. So I was able to go to Catalyst. They evaluated the project, and we got up and running a whole lot quicker than I thought we did. In terms of operationalizing it, we started out in my practice. I'm part of a very large primary care practice, the largest primary care practice in Douglas County. And then we involved our population health group. So that's people who may have been in the emergency room, or the practices identify them as very high utilizers of care. So those people were able to sign up the MAP Habit folks. And then most recently, we're adding in our neurosciences division as well. So we kind of took baby steps, and we're ramping up as time goes on. But it all had to start with the funding, and we were very fortunate to have that relationship with Catalyst. Their whole point is to find innovative solutions for big problems.
Can I ask you a question?
Yeah.
It was unscripted. How much of your job is to wake up in the morning and find funding for innovations like MapHabit?
Luckily, none. I get to come up with the problem and then turn it over to other people. Now, luckily, as a service line, we have a contact in Catalyst. Eddie Chin is our contact. So if I came across something innovative, first person I'm going to go to is Eddie. It's like, Eddie, look into this, and they'll look into it.
Before you get me with that unscripted question, Chris, so I'm actually also the co-chair of the Georgia for CareSource, the Georgia Foundation chapter. So a lot of stuff comes across my desk on a daily basis as well. In case you were going to go that route, Chris.
No, I wasn't. What has me thinking about it is I was in the audience at a panel last week with a group of folks that are innovating around health equity, and there's about 1,000 people in the audience, and the panelists asked everybody to raise their hand. Who's innovating in health equity? And 98% of the people in the room raised their hand. And he said, keep your hand up if you know how you're going to fund that innovation. And everyone put their hand down. I mean, everyone put their hand down. And so that's Dr. Creighton, why I wanted to ask that question for you is that I don't think there's any shortage of ideas for innovation. Everybody's trying to figure out how do we pay for it.
Well, and that brings me back. I have to be a good steward of my system's resources. I remember being at a meeting years ago talking about a budget and a project we wanted to do, and something that always stuck with me is one of the executives leading the meeting was, is that worth having one less nurse on the floor? And that's really how we got to think about it. But again, that's why it's nice having alternative avenues. That's their whole job.
So real quick, to follow up on that, what was the basic? I mean, how did you frame up the pilot? Was it a collaborative with Matt? Did you already have clear structure, objectives, metrics in mind? Where did you end up in terms of objectives of the pilot, and how did you measure it?
Well, I actually started out much more ambitious and too ambitious for my own good. Matt's published that caregivers and patients do well with this and like it. I took it to the next step and said, well, that's going to equal fewer calls into my office. That's going to equal fewer visits into my office with problems. And ultimately, I wanted to do a full-on study. What did that mean? Satisfaction, but also real metrics. Decreased emergency room visits, decreased medications. One thing I love about these two guys is you can control behavior in behavioral health issues, Alzheimer's and children in crisis. You can control behavior with medication, but they're going to have a lot of side effects. So I love these guys have a solution that isn't going to have medication side effects. So, we sort of ramped it up that way.
Great, thank you. And so, Adam, it's your turn. A little bit about
I think
scope of the pilot and all that.
Yeah, but also unscripted, go back to something. I mean, last year, I think we had to turn down $9.75 million in grant requests. So I know Chris said it sort of tongue-in-cheek. It doesn't always work out this way. I mean, I wish it would. I wish that we had infinite funds. I wish I could help all 485,000 single families and members, but we got to take, in some ways, a one family approach at a time. But again, a lot of hard work. We were able to make a difference on this one. In terms of outcomes, I alluded to this in the beginning. Excuse me. We're looking mostly to see not separation of family. You don't want to see, and by that could mean going to a long-term facility, having to go to an out-of-state facility, ending up in the foster care system. For those in the room, that have worked with kids, just taking a kid out of a home for a couple of days, or if you're in a facility, I did this in another lifetime. It's traumatic for those kids. It's traumatic to be displaced. It's traumatic to wake up somewhere where it's like, this is not my bed, this is not my room. So that's my passion. I hope that's coming through. We were looking to reduce that, whether it was in terms of not being admitted and or should something happen and there was decompensation, reducing the amount of time that they would be there. And we were successful to see that. Then as a follow-up to also before, Chris was just one part of it. So it's not an infinite funding source. We were able to do that in terms of art pharmacy, but also from, not too much in the weeds, but from an encounterable claim standpoint, we do have facilities we can work with where we were able to do wraparound services, maybe amend a couple of contracts. So it's a multi-pronged approach in addition to maybe grants.
Great. So getting back to my question, yes. I'm a data guy. So metrics, objectives of the pilot, what was established and how was it established? Was it a collaborative, did you establish the goals of the pilot together?
Yep.
Or was that something that you dictated to Chris and Chris said, okay, we'll do it?
Yeah, so going in, I had a global vision as far as what I wanted to do for the pilot. I really wanted to see those three things. I wanted to see not disintegration of the family, reduction of admits, and reduction in length of stay should there be admit. Working with Chris, that was going to supplement that with art pharmacy and be a part of it. And we were fortunate to a lot of hard work of our behavioral health team, our case management team, CareSource as a whole, and our external partners to see that come to fruition. So I laid out the metrics with the vision before. Hypothesis was if we can do some alternative modalities, we might be able to move the needle.
Great. I mean, it's really insightful to see this is a case where startups are not selling to the C-suite. They're building those relationships, building the partnerships with and finding those product champions to help them drive forward with validation of product, and then hopefully it will get to a point of sales. But it's a multi-step process, and I really think they're following the right approach to that. Okay, so tell me a little bit about your takeaways or what you've learned from the pilots, the time together, on a couple fronts. One is, was it successful? Did it meet your goals? Or is it in the process, is it looking like it's headed that way? Also, what are your learnings? Is there anything that you take away that again reinforces the idea of having a local partner, a collaborative partner, especially if it's a startup, that you would like to share?
I mean, we've learned a lot of ways not to do this. First and foremost, any of you out there, if you're going to put something else on the doctor's plate, don't do that. It's not going to work. Even if it's 1 minute, they don't have 1 minute. But one of the great things about working with Matt's team is we meet bi-weekly to talk about the struggles, and they have been amazingly nimble. And one of the great things about working with a startup is they want to provide this service to you. They want to get better. They're trying to get better. So we've done multiple PDSA cycles with them on changing how they were originally doing things as well, and then how we're doing things, how we're signing people up for this. So I opened different avenues for people to be able to get into the project, knowing I couldn't rely on the doctor selling it to the patient in the room. Sometimes the medical assistant didn't have the time. So between enabling the whole team to be able to do that, so the doctor can do it, the medical assistant can do it, our population health can do it. So we've got multiple areas. They've been great about, okay, well, maybe we just do interest calls. The patient isn't sold on it yet. Nobody wants to admit they have dementia. What does that mean next step? Does that mean we're taking the car keys away? That's a big deal. Nobody wants to admit that. And something we've learned about the tool is it's probably better as a preventative anyway. Okay, so if we can get them started early, we can't wait till somebody's advanced dementia. It's not going to work. But I think the one thing I'd stress with everyone is working with a local startup is they're going to be much more nimble than a big organization that's already got their structure. They've got the way they do things. They know how to do this. There's always a new way to do things. And one of the great things of working with them is they've been exceedingly nimble in fixing things.
Great.
And I'll just add to that, Wellstar and Dr. Creighton and the rest of the groups that have collaborated with us, they've been very flexible and understanding. And, we're resource constrained. We don't have, 100 years of experience like Wellstar has. So in a sense, we're building the airplane while we're flying it. And, that's the case of early stage companies. So we've had to do things to change all our member facing materials to kind of talk about the benefits to the caregiver instead of the benefits to the person. Our platform basically allows you to visually map out your daily routines, like making coffee. Sometimes that can be really useful to use in the electronic platform. Sometimes using a paper-based printout is going to be a more effective way to get utilization out of the platform, even though you're not collecting as much data. So they've been really helpful, like giving us advice on ways to implement it and being very, showing us a lot of grace as we've been going through it. So it's been a really great experience.
I think to that point of advice, coming from CareSource, I think so important for early stage companies, all companies, but certainly early stage companies, to listen to their early customers about what won't work, and Adam, how many lives did you say here in Georgia?
Totality, 400, roughly 500,000.
That's a lot more lives than we touch every day, and so there's just a lot of knowledge that an institution or big system or partner like CareSource or Wellstar has that we need to be learning from, while also trying to bring new ideas and innovation. And I think that's where the tension is, but. I think that the best change happens at tension points.
Great. Okay, so the $1 million question. Adam, is there any plans for follow-up on the pilot?
Yeah, so we are in the process of scoping out, I'll call it for now, loosely titled Stronger Together 2.0. And, Chris and I have had talks about what would be the next evolution of that, as well as with other partners. So more to come on that. We have some other minor hurdles to get through before we can do that.
Fantastic.
Nothing with Chris.
Thank you. And Dr. Creighton, where are you with Map Habit? What are your thoughts?
Well, and I'd mentioned earlier that I wanted to do something more robust, mostly to be nimble and sort of a proof of concept at Wellstar, whether this was going to work. We rolled it out as a pilot. It was a whole lot easier, didn't have to go through IRB or those kind of things. But my ultimate goal would be to do a full study with full data. They're monitoring some data, and we're going to get it de-identified. But I'd like to ultimately have something that we could all publish.
Fabulous. Any thoughts from Chris or Matt?
Well, yeah, just learning about the different outcome measures, whether they be HEDIS or social determinants of health or medical utilization, that's going to help us to have that data to then expand the number of people that we can support. So it's been that's part of our goal as well.
Great. Anything, Chris?
Thanks for the opportunity
All right.
to be here and partner.
All right, well, we're on time, so I want to thank you all. Thanks to our panelists for participating in this conversation, and thanks to you all for sticking with us at this late point in time. So, hope you had a great day.